Hi, my name is Judie VanKooiman, and you're watching Life Issues. This month's show is about Longwood Care. And Michael, would you like to introduce yourselves? And
I would absolutely love to. It's a pleasure for us to be here. My name is Michael Svechnikov, and I'm the president and CEO of Longwood Care.
okay, and Alicia.
I'm Alicia. I'm a psychotherapist at Longwood Care, and I'm very happy to be here as well.
Right, well, welcome both of you. I appreciate it very much. So, Michael, I'm going to start with you. You just mentioned that your title is president, and is that just president of Longwood Care? Is
Well, so what we so our organization is a younger organization, and we try to maintain sort of a flat organizational sort of structure for the time being, for as long as we can. We want everyone to have input on the organization. We have a lot of great talent and a lot of great experience that comes with that. So we want to leverage all of that. We don't want to have any unnecessary structures and sort of anything that would impede our clinicians advising us on administrative affairs, or any administrators being able to advise any clinical affairs if they can. Obviously, there's a certain sort of barrier to some of those, but we want to make sure that we get the best and the brightest, and we want to make sure that we get all the input into the organization as we can. So we look for the best talent, and we want to maintain the flat organizational style for as long as we can to be able to use that to our advantage.
Right, that's great. And Michael, when did Longwood Care become a nonprofit?
So I'll start just a little bit farther back. Longwood Care has been the brainchild of Anna, who couldn't be here today, unfortunately, because she is 9 months pregnant. It's been something that she's been working on for more than a decade. The nonprofit piece of it came about around October 2016, and that's when we got our charitable status, our 501c3 charitable organization status. And that was in part due to some of the services that weren't accessible, and I can certainly expand on that and tell you a little bit more, and I think there's a little bit more to talk about there. It was due to the commercial insurances, such as Blue Cross Blue Shield, typical things that individuals have, not necessarily Mass Health or Medicaid policies, but strictly commercial policies, the ones that you get through your employment. Some services aren't accessible to those individuals, and the 501c3 status allowed us to collect donations and funds and support individuals for things like therapeutic mentoring. And that's that's a service that only Mass Health clients have, with a hub, with a lot of let's say paperwork and a lot of supports in place already before they can get a paraprofessional for, let's say, a youth, an adolescent, to have a paraprofessional to support them and provide a mentoring service, but someone from a perspective of psychotherapy. So they get sort of not only an adult that can mentor them and to guide them in school, in high school, but also provide sort of the initial basis for therapeutic work if they need it. So that was the nonprofit piece of the organization. If there's anything that I missed, or you'd like to add?
And why did you want to open Longwood Care?
So this goes back the decade ago. This is something that Anna has been working on, our executive director has been working on for a very long time. She went to school for therapy, and she was one that was always out and about. She was always very good with people. She was always very in tune to people and individuals and their feelings, their perspectives, and it was always very easy for her to question and to dig deeper and to find out a little bit more. I have a funny example. To clarify, Anna is my wife,
right,
as well. So I'm an employee of hers at work during work hours.
And then
at home, I am husband, but I can also be fired. But all jokes aside, I think we had a party for all intents and purposes at work, and I think I used to be there. I was there for about 6 years, and she came to the party, and I think she found out more about the individuals and my friends that my colleagues, in 2 hours than I've known about them in 6 years. And this was just strictly based on her approach, the way she is. I think she just has this innate talent that is able to, she can relate, and she could sort of ask questions. She's not afraid to ask questions, which is what a lot of us are sometimes, and more oftentimes,
exactly, right,
are very much afraid to do.
Yeah. Alicia, I'm going to switch over to you. And what is your title?
I'm a psychotherapist.
Okay, what does that entail?
So we are trained in therapy. I have a master's in clinical mental health counseling with a concentration in health and behavioral medicine. So providing an array of services for individuals, families, couples, children, teens, you name it. So, yeah, a
Very
therapist.
detailed.
Yeah.
Okay, great, thank you. And what areas do you focus? Just the ones that you just mentioned, or?
So we focus on anxiety, depression, post-traumatic stress disorder, gender identity and sexuality issues, autism spectrum disorder, you name it.
Okay. And what does your outpatient service provide?
So we provide these services to help strengthen individuals, families, children, couples, anyone that comes in through the door seeking help. The bottom line is that we're here to help the clients and strengthen their skills, their needs. A lot of individuals suffer from emotional and behavioral needs that limit them from their potential, from their functioning. So we are there for them to help guide them and kind of navigate through of, okay, what's going on for me right now, so that they can be able to have healthy functioning at home, school, work, and in the community.
Right, okay. And is it strictly just outpatient care that you provide?
At this time, yes.
Right, okay. All right, and Michael, what is your mission statement?
The mission statement is fairly general. In terms of what we provide, we focus on building strong families and communities through prevention, through support, and education. And so I know those words in and of themselves are fairly general, but I think if we were to just start to dig deeper and to see what it entails, we can sort of figure out how this applies to the work that we do. I think what Alicia maybe didn't mention was that she's a licensed she's a licensed mental health counselor. So the work that she does also focus on substance use, and that this, as an outpatient service, is a voluntary service. That means that our clients seek out our services rather than sort of being forced or told to go there. We do have some clients that are mandated in some cases, some involvement with the state, and those are all welcome to come in. But a lot of the work that we do in the outpatient facility is the clients that seek out our services and our help and have decided to come in because they know they need it. In terms of the mission, the prevention portion of this is very important, because I think, as a lot of individuals and a lot of research has realized, is that preventing things like stress and anxiety allows the individuals to avoid sort of an escalated service, emergency care, inpatient, residential, or even something that manifests itself as a physical ailment. So as stress builds up, and so you have a very high stress job, and you experience that day in and day out, that could potentially lead to other more severe issues. That could lead to substance use. That could lead to some physical bodily ailments that you might require emergency care for. And those particular services are much more expensive, as insurance companies are starting to realize. So for them to be able to prevent any admittance to the emergency room is a fantastic opportunity for them to provide, one, great services, to have great insurance policies, and overall just have a really good sort of support network within their organization. So they're able to provide much better care. In terms of support, that's something that we provide to families. So when you have maybe what we're used to as traditional, let's say, psychotherapy, is you have an identified client. You have somebody that comes in for a specific reason, right? But in a lot of cases now in our society, in our world, we're seeing a lot more families that are becoming a part of the solution, and that might be a part of the problem, but also a part of the solution. So we want to make sure that the families are involved. So we want to be able to provide the services not only to the individual that might need that initially, but also to make sure that their support network is also being able to provide those. So that leads us to the education piece, where we're able to work with parents on making sure that we're working with them to, if we have a young child that comes in. So perhaps the family's stressed, they have their work schedule, they have their requirements and things that they need to be doing, so they might not have as much, might not be paying attention as much to the child. So we work with them to build structure around their day, to make sure that there are boundaries in place for the child to understand sort of, this is okay, this is not okay. And so someone like Alicia here would be able to implement things like behavior charts, any coin systems, and allow for the family to be able to resolve these lower level issues. And as an outpatient care facility, we are classified as the lowest level of care. So we want to make sure that the clients that we service maintain the lowest level of care and or not any care at all at our facility, and not escalate into an inpatient or residential, the emergency room, or anything else like that. And so I think a lot of insurance companies under the ACA, under Obamacare, are starting to realize that a lot of these services that may have been sort of overlooked at some point in time now are, for all intents and purposes, adding to their bottom line. They're more effective. A lot of the policies now that they're providing that require mental health services are a lot more effective and are hopefully saving money, and so that they're able to improve the quality of care and still exist as an organization.
Mm-hmm. Okay, great. And Michael, where are your locations?
So the new location that we just opened up is in Danvers. It's at 5 Cherry Hill Drive in Danvers. And it's a beautiful space. It's brand new, just redone, 4,000 square feet. We'll house 6 to 7 clinicians. It has 13 office spaces. It has all the tools and resources that our clinicians and psychotherapists would need. And the other location is currently, the original location is in Swampscott. So it's at 21 Railroad Avenue in Swampscott. And that's also a beautiful facility that we've redone completely. And that currently houses three clinicians that are able to service the communities in and around Swampscott. We work very closely with the town of Lynn. We actually work very, very closely with Winthrop and Revere. We work in the school systems there. And we have a number of adjustment counselors that refer to us exclusively because of the support that they get and the care and the quality of services that they get at our location. So we actually have individuals that drive from 35 minutes from Revere, from Winthrop, to our offices in Swampscott. We also are starting to be found to be found from individuals that are unable to receive services because there's a bit of a lack of services in terms of behavioral health. And so we see individuals driving as far away as Bridgewater and Georgetown and Rowley. And so we have individuals that's the reason for the Danvers location. We have individuals that in that particular North Shore area, there's a little bit of a drought in terms of services and what people could receive. So there's a lot of focus on the Boston area. Places like Chelsea and obviously the metropolitan Boston area has a lot of facilities and a lot of services in place and available. But a lot of the the outskirts, let's say the North Shore and a little bit farther north, it's a little bit more of a challenge for individuals to find the services that we provide.
Right. Okay. And Michael, what are your evidence-based practices?
So we actually wanted to switch that up. I'm going to let the clinician answer that question.
Okay. Alicia?
So evidence-based practices are like a science experiment, right? You have to create something to see if it will have validity. So when you conduct an experiment, you have to test it to see, okay, is this actually going to work? Is there a fact in this? Is there a truth in this? And so what evidence-based practices are, they've been studied over time from various psychologists, therapists, individuals in the field of psychology to be like, okay, this is something that is going to work. So like cognitive behavioral therapy, they had tested it out to see, let's see if this will be effective. So the individuals that have created these types of approaches have found scientific basis in them. So they are effective. Individuals seek these types of treatment, and because they are known for their effectiveness.
Okay.
And so these are similar to, I believe they're known as modalities within the
Yes.
field, but they're basically theories. They're things like gravity. We think we understand that it exists, and the more it's applied, we see the more results, and the better the results, we'll continue to use and improve those going forward. And so some of those, and I think you might be able to speak to better to, there are things like cognitive behavioral therapy, there's dialectical behavioral therapy, there are some trauma-based focused therapies that have been proven to be very, very effective to the individuals that are receiving them. So.
Okay. Great. And Alicia, what are your approaches?
So like Michael listed, the CBT, the DBT, those are the main ones that individuals come and seek because of their effectiveness. So cognitive behavioral therapy, or CBT, kind of looks at the thoughts, behaviors, and emotions. And so we connect each three, and it's kind of a cycle. And so one will cause the other, and then will lead to the other. And so with the individual, we break down what's going on for them so that they can see, okay, this is why I'm anxious every time I go out to the market, or this is why I feel this way. And so it helps put it into perspective for them. Okay, this is what's truly going on, and how can I work towards alleviating my symptoms? Trauma-informed care is also another effective modality of treatment, helping individuals focus on why the trauma that they've experienced, whether it's living in a shelter or being in an abusive relationship, affects them the way that they do. And that is an intensive modality of treatment just because of the nature of it. But we also focus on behavior management, as Michael mentioned, person-centered therapies, solution-focused therapies. Whenever the client comes in, some individuals ask for certain types of these approaches. Sometimes we will stay with one approach. Sometimes we might go down the road of something else. We're here for the individual, so things might pop up that they didn't expect to pop up for them. So overall, it's helping them and guiding them through any type of approach.
That's great. That's good. And what do your services address?
So we address interpersonal and problem-solving skills. So that's, again, thinking of why is this happening to me? How can I deal with it? What can I do to deal with it? So that goes along with coping skills, things that you can do to reduce your symptoms, your stress, your anxiety, your depression, problem solving through it with the clinician, trying to find out why these things are happening. We also focus on emotional and behavioral control. So a lot of children with behavior problems or tantrums or talking back. So we help parents and families guide through that, and with behavioral modification, trying to see what is going on and what the root is of the problem so that we can help support them best. So it's kind of looking at the person, looking at the family as a whole, and helping them put their pieces of the puzzle together to help them solve it.
And they have the wonderful people at Longwood Care to help them
Most
along the way.
Right.
Okay. And Michael mentioned some of the towns that you do cover. Do you cover any others in the surrounding area besides Winthrop and Revere, Swampscott?
We do have individuals that travel from Boston as well to seek our services, as well as southern New Hampshire.
Wow.
So
Oh, there
people
too.
come from all over. Because there is a lack of services available, people will.
That's too bad.
There's a need, so we're
There's-
glad that we can help whoever comes and asks for
Right,
help.
definitely.
So just to touch a little bit more onto that particular area. So in terms of the types of services that are available for individuals, it really depends on the insurance that these individuals have. In a perfect world, everything would be accessible to everybody. But unfortunately, some insurances cover only a specific set of sessions. Some insurances only cover a specific set of services. And so the two types of insurances that most individuals have would be either a commercial policy, and that would be, as I mentioned, the one that you'd get from an employer, or a privately purchased policy. The other policy would be the mass health policy, the Medicaid policy. In what we've noticed is that the Medicaid policies, in some cases, are much more effective and much better at covering a lot of additional services and allowing the clients to get back to sort of a normal status, a normal life, much quicker because of the types of supports that they have. In terms of commercial policies, you typically have one session a week. It's either a 45-minute session or a 60-minute session, and that's one of the challenges that has existed for a while now. We're working in terms of doing advocacy, in terms of working with some representatives in the state to be able to see if we can get additional services for these individuals. And this, again, as I mentioned to you, was something that built the organization, is being able to provide the therapeutic mentoring to someone with a commercial policy, which is inaccessible to them. To have, a grown-up or a younger adult or an older adult for an adolescent to be able to mentor them and to be able to provide some psychotherapy services along the way. So that's something that we're working on as well. And then the mass health policies typically cover a range of services. They don't have copays, they don't have a co-insurance, they don't have a deductible. And so some of these things are preventing individuals from accessing care. Someone that has a high deductible policy may not want to utilize their behavioral health services because they might have to pay $1,000 or $2,000 out of pocket, or come in and pay up to $50 in the copay per session. And so we're definitely and actively working on trying to figure out how to change this model in the state of Massachusetts. I think one other thing I neglected to mention was the types of services that are available themselves. So I mentioned the insurances, the split between the two types, and then the services in terms of outpatient. Then you have sort of these higher level emergency services where you have inpatient and residential, and then you have in-home or in-school therapy. So you have the outpatient model is where a client comes to see us at our facility. And I know this goes back to the towns that you mentioned that we service. So we'll be happy to see clients from anywhere that anyone's willing to drive from. And as I mentioned, some do drive a longer distance than others. Another service is the in-home service, where a clinician goes to the home of the client and provides these services in-home. And so they're able to see the child for an hour or two. They're able to work with the family there, specifically in the area that might be causing some of the issues. And then in school-based as well services. And so those all have sort of their efficacies and sort of their pluses and minuses in terms of seeing somebody at the office, or in seeing somebody in school, or in the home. What we're finding is that those services are definitely effective, but we're seeing a lot quicker change that happens in the office, where we are able to take them out of that particular environment that might be causing some of these issues. And the sort of the limited time that we have with the client allows us to focus specifically on the therapy at that point in time, rather than maybe having to deal with a barking dog or a television, basically competing for attention.
Right.
Or even being able to work on trauma therapy, or process trauma with a child in school. If we're sitting in the cafeteria there with kids eating and screaming, and we have to process some sort of possibly significant trauma for 45 minutes, and okay, go back to class now, and enjoy, I guess, being bullied on, instead of actually taking that child out of the specific environment that might be causing some of these issues. And then so I feel as though the work that we do in our office right now is a little bit more effective. But again, all of those have their own sort of virtues and benefits. And so we are looking in the near future to be able to provide in-home therapy with the next facility, which would grant us CBHI, access to CBHI, which is the Children's Health Behavioral Initiative.
Behavioral Health Initiative.
Children's Behavioral Health Initiative. That's the one.
That's great. That's great that you're doing that. And Michael, you mentioned a couple of insurance companies that you do accept. What are some of the others?
So we accept all forms of insurance at the moment. We accept Blue Cross Blue Shield. We accept Aetna as an out-of-network provider currently, but it's going to change in the next couple of months. We accept Optum, United Behavioral Health, and Harvard Pilgrim, which is all the same company. So we accept all of those. We also accept third-party administrators for any one of those that I mentioned, and Mass Health. And so that includes policies like Massachusetts Behavioral Health Partnership, also known as MBHP, Tufts Commercial as well, so that was the other one that I missed on the other side. We accept Fallon. GAC is one of the providers for the government employees, which has another set of providers underneath that. We accept all of those. And NHP, which just was, I believe, either acquired or partnered with Optum. So basically, any insurance policy that you have, we will accept, and self-pay as always. So if somebody is in between jobs or in between policies, they're more than welcome to come in. So there's no restriction as to who we would see or when we would see them.
Okay, great. And how do you transform child and family support networks?
So that's one of the biggest challenges that we are faced with on a daily basis. This is one of those areas where we want to make sure that, for starters, individuals have access to behavioral health services or mental health services. And so what the organizations that we've partnered with, we're non-exclusive to anybody. We have referrals that come from Children's Hospital Boston. We have referrals that come from adjustment counselors. We have referrals that come from PCPs, from churches, from almost any organization that would be aware of that these services are available. I think one of the biggest challenges that we're seeing is that employers are either less informed or maybe not sort of as aware of their policies as they should be, but there's a great EAP service that's offered through most providers. So that's the Employee Assistance Program, where an individual can be sort of not told, but sort of volunteered, told, if you will, to go see a therapist. So someone's experiencing a high anxiety at their job. It's a high stress job, and so if they go see their HR manager, that HR manager should be aware of these services in the policy. They should be able to say, listen, our policy covers X number of visits. Let's see if we can set you up with a therapist. Let's see if we can sort of figure out what's causing some of this stress, some of this anxiety, and let's get you in there. And it's all covered. So the individual, as I mentioned, even with a commercial policy, doesn't cost them anything to see a therapist. And I think the services are effective, at least to start the process and to start to process what's going on is the first step, And that's one of the ways that we are trying to focus to make sure that these services are accessible. The other part of it is we maintain a no waitlist policy. A lot of the providers sometimes aren't able to accept an insurance. So a lot of individuals, private practices, might not be contracted or credentialed with an insurance provider. So you might call a dozen providers and you have Blue Cross Blue Shield, and they might say, I'm sorry, I don't accept Blue Cross Blue Shield. You can come in self-pay. And so, when you're paying a premium for your insurance and self-pay for a service that you should be getting, that becomes a bit of a barrier.
Right.
And then ultimately, some of the larger providers we've heard have massive wait lists for these services. We've seen at points in time in the year, it seems like it's a seasonal type of scenario where during sort of the transitional period, in whether that's in a season or whether that's the start of school or the end of school, we start to see an influx of individuals that start to develop certain issues that maybe, that's the straw that broke the camel's back, basically. And so we see an influx of individuals seeking our services. And we've heard from larger providers and larger institutions and facilities that they've had a 6-month wait list. They've had 400 clients in referrals that are waiting to be picked up. And so what we try to do is maintain that no waitlist policy to make sure that it's accessible and as quickly as possible. Most of our clients are able to come in to get services either same day or within the same week
Nice.
at maximum.
Great. Okay. And Michael, if anyone has any questions, can you please give us your contact info?
Absolutely. It'll be on the screen right here, I hope.
Yes.
So we have one main number for both facilities. It's 781-600-5501, or you can find any and all information about us at www.longwoodcare.org.
Okay, great. I'm sorry, but that's all the time that we have. Thank you both for all you do for those in need. I'd love to hear your thoughts and suggestions. Please send them to lifeissuestv@gmail.com. And remember, live each day to the fullest and celebrate life.